Dr. Singh, welcome to the show. Truly thankful for you for accepting our request to be featured in the show.
You're welcome. Thank you for inviting me and thank you for connecting with me. I'm looking forward to it.
Yeah, my pleasure. In our previous just exploratory meeting, I was just hearing your thoughts and then your experience in the industry, and then the one thing that stood out for me was your exit and your new venture. So I just want to start with that shift. Like you worked in the industry for over 30 years as a physician, and you worked as a CMO at ChenMed, and what was the internal catalyst that led you to transform from W2 employment to an independent contractor in 24?
I think, as a physician, having been in medicine for 30 years, I have, sometimes when you are on frontline physician, you do think that for the change to happen, once you are a clinical leader, the change can happen. Like you can affect the change. Like that's what I thought. That my whole journey would be. I used to dream about how I would help physicians with physician burnout. This is way back. I'm talking even 15, 20 years. I used to think that hospitals would have this absolutely, I'm also a holistic nutritionist. So they would have this unhealthy food for lunch for doctors. And I was like, okay, we need to change the very menu because if doctors are going to eat this, then this contributes to their lethargy and lack of energy and then having coffee. So all that is contributing to physician burnout. So I used to think maybe I need to start working with the hospitals and change their menu for physicians. So that's where, I've been thinking about physician burnout for a while. And then I've experienced it from time to time where I felt at a hamster wheel. So different jobs, I reached a point where I was like, okay, this is not going to work for me. Eventually, I came to the idea that fee-for-service model is not going to work for me. So in 2019 actually, I decided that I have to figure out a way to get out of fee-for-service model because it seemed like it was based out of productivity. So there was no end to it. Like I could not do enough ever. So I was, really busy, but it just was never enough. So then I thought, well, there's got to be a better way. So that better way eventually, I started applying and found value-based care, ChenMed, right? So this value-based care seemed like the answer. And I remember when I interviewed way back in 2020, they told me all the great things. And one of the things I said was, this sounds too good to be true. Is it really true? And they're like, yes, it is. And, I interviewed actually that time with multiple different, I think it was 5 different companies that I had interviewed for. The moment I put it out there that I'm, there were recruiters reaching out. So for physicians, anytime you put it in whether it's Indeed.com or anywhere, the moment you put it in, it's there's not lack of jobs or lack of recruiters reaching out. So I didn't know anything about value-based care, but it sounded like many of the companies that reached out were value-based care. So I ended up interviewing actually in the same week with multiple value-based care so I could compare them. And I liked what I saw. And I thought this doesn't seem productivity based, but really outcome based. So this is going to be great. And it did start off as really great and seemed to be the answer. But as you get into more and more, what we find is that business of medicine takes over. Things can shift. And I started seeing some of the same issues as fee-for-service creep into it because sometimes the people being employed are coming from fee-for-service model. So then they bring that without changing the mindset. So we were these clinical leaders. So then I got into leadership and I thought this was the shiny object for me. I had the shiny object where it seemed like if I became a clinical leader, my whole drive to be a clinical leader was to reduce the burnout in physicians. Like I'm going to be the savior. I'm going to now all the physicians that, because I was the CMO for Ohio and Kentucky eventually. And so it seemed like that's what I would be able to accomplish. And really, there were some great leaders in the company that were dedicated to that cause. And we did move the needle a little bit. Along came this, I slowly started realizing that when medicine becomes a business, then sometimes we do lose sight of the physician well-being. And actually, it becomes where physician well-being actually becomes not only an afterthought, it's almost not even a thought anymore. I had more physicians not having a lunch break, and that's like a pet peeve for me. I'm like, if you're not going to eat, how are you going to see patients till like 5:30? You can't start a day at 7:30 and go on to 5:30 without a lunch break and a proper lunch. So I have tried my level best, but I eventually realized that first of all, I have to find a way where I can get myself out of the hamster wheel. And then is there a way to help other physicians get out? So I started very, it wasn't, initially I didn't know how it was going to happen, but it started with just looking around and seeing, is there the whole idea that somehow value-based care is better than a fee-for-service. I haven't personally found that true from the physician perspective. From the perspective of a patient, maybe, from the perspective of healthcare cost, maybe, but from the perspective of the frontline physician who's seeing patients, I am not seeing enough change, because both are driven by what makes the most for them, right? So both ends feels really tiring for the physician. The number of burdens that, and this is not one, it's just the whole model is designed like that. So it's not about one company, or it is about value-based care, or how profit is generated there and how the profit is generated. It is about that bottom line. So that led me to start looking, and I came to the point where, I'm also growing older and somewhat wiser. So I realized that I got to figure out a way to be an entrepreneur and figure out a way to own my time and own how I'm going to manage my time without dropping my income. So telemedicine came to me accidentally through one of the recruiters. They reached out to me and said, like, if you want to, it's a small gig, you can try it. And I did try, and I was like, wow, this is cutting edge in the sense that AI in healthcare has come. Technology, when it came into healthcare way back when, the charts became electronic, it has not supported the doctors. So it came as if it was going to support the doctors, but it became even more documentation. It became worse for the doctors. Now we had even earlier, when we were doing paper charting, we could take some shortcut. Now there is like million mandatory stuff we have to do. So it doesn't look like I didn't feel like the people designing the technology, the platforms, the EMR system, the electronic medical record system, were really taking into account the physician lens. They were just looking at it from the documentation purposes, for legal purposes, medical legal purposes, but not really taking input of what makes the life of a doctor better. Or they're looking at it from the patient perspective, where they're saying, okay, everything needs to be documented, but could it be that you could do both or all three things? So now finally I'm finding with AI in healthcare, there is a shift. First time I have found the telemedicine is a platforms where the platforms have become physician friendly, where they're not just that it's reaching the remote areas of the country, but they're also making life easier. So it's helping the patient. It's helping patients in areas where there's one doctor or no doctor for miles, or they're like even today I was seeing a patient who had, for an urgent care, she's got massive skin infection, and she was seen in November by one of the urgent care in the platform that I work for. And Now I'm seeing her again. It's actually, she sent me the picture, and the cellulitis is actually, the skin infection is actually worse, but she hasn't been because the copay is $200. Whereas on telemedicine, she does not have a copay. So they have been able to design platforms where they have looked at the economic of it too, where it is patients have less copay, doctors in not spending so much time into it. So that's why it's actually cheaper for the patient too. And there's not the brick and mortar is not there. So, the expense is reduced overall. And doctors have got the flexibility of time and space. So it has led me to design a life for myself. I realized that I need to gradually figure out a way out of the system and not work for anybody. Nobody got to tell me how to do it or become my boss, but can I be independent? So right now I've set up my own LLC. I actually, took help. The way I did it was like any physician that was doing telemedicine. I just asked them very openly, honestly, I know nothing. Can you help me? And people started helping me. There's one physician, he helped me and told me how to set up an LLC. I did that in Florida, all by myself online. And then it was like, okay, I need to start getting licenses because telemedicine means licenses. Now, what does that look like? So, which licenses should be applied first, which not? So, that was quite a tricky process to do. So, we can talk more about it in the next section if you want to talk about it.
Yeah. I just want to come to that. Like, now you hold the medical licenses in the 52 states, right? And then you just explained how this telemedicine is helping you to figure out not only what to do next with your entrepreneurial journey, but also it is helping you to manage, or rather to own your time uh, by providing more security than a traditional executive role. So I know it started as a gig for you, but at what point you decided to extend it to all the states?
Yeah. So that was 2025. By the time, so I, started as a side gig end of 2024. And by early 2025, so we're talking by February of 2025, I thought it's either go all in or not. And why I wanted to go all in is because so all the 50 states plus DC plus Guam, those are my licenses. And so there are companies, telehealth companies, AI and healthcare companies that are wanting to reach all the states. So if I want to have, it's like go all in or don't go. Like, you can't learn swimming by, putting your feet in. You got to jump at both feet. So it is a choice, though. Like, there are telemedicine physicians that are having maybe 15 state licenses. They go for the biggest state. I wanted to get into, this is cutting edge. AI in healthcare is cutting edge. Now, I'm not to, there are enough, guardrails we need around AI. I get that. But it is cutting edge. It is where I see the medicine will be more reachable and less expensive as a country, as for the patient, for as a whole system, the way US healthcare, how expensive it is to control cost, AI will play a big role. And so I wanted to be at the front of it. I don't want to be like, I had no trepidation about it. First of all, I love change. So I'm not, there are those who love change and those who are resistant to change. I'm the one who jump into change first. So a lot of the companies, tech companies that are launching into this, they want to launch in all states. So if they want to launch all states, they need to work with physicians that may have, or if they need like a medical director, or they need somebody who that in the leadership, they would also like to partner with somebody who is into all states, right? So has licensed in all states. So for me, it was like if I want to make a change, and I don't knowing myself, I know that I'm full of creative ideas. I can't just be the frontline doctor. I need to be able to change, be part of the change. So I wanted to be broad enough that when time when needed. And actually, that has helped me. I just signed a contract with another company today. And the one reason they reached out on LinkedIn to me, and it's a perfect opportunity for me, it's they're doing telemedicine in the field of nursing homes, which is amazing because nursing homes, I've done nursing homes for so many years, and in nursing home space also, there's so lack of providers, so to be able to do telemedicine where they have nurse practitioner and I'm going to be the collaborating doctor. But the reason they reached out to me on LinkedIn because I have all 50 state licenses. And as the company will expand, so will I be able to support more states. So that is where it started. It is any physician right now that is wanting to expand. And when they reach out to me, I'm able to guide them of how to do it. It is an initial investment. I found a great company to work with, but it is it's worth it. I'm already seeing the benefit of it. So you got to be very persistent. So I started in end of February and I got my last one actually mid-November.
Yeah, so I just want to stress on the point that you raised AI in healthcare. Like last week, I was talking with a cardiothoracic surgeon from Miami, and then the way he explained the AI and then how it is going to help was a different take for me. Like the way he explained the AI in healthcare, why it is essential is because it is not going to. The question that I asked him was, is it going to cut uh, the doctor's job in the future? And he was like, no, that's not the way how you have to look at it, because there are a lot of people who are unable to see the doctors, the surgeons especially, because either A, they don't have access, B, no, they don't have enough money, they cannot afford. And then he told me, he already started uh, reaching out to more patients from the remote areas, and also to the more patients who are unable to afford the surgeries. So he was like, now the people who are at the top pyramid, they're already getting the great treatment. It is not going to uh, dent anything over that part of the business, but there is a huge chunk of business that is below the top. And that's where he said AI is going to reach the quality care to majority of the people across all departments of healthcare.
Absolutely, absolutely. And then also, there are certain fields, like I'm doing bioidentical hormone replacement therapy, for example, with the company, one of the companies where I'm the medical director. And bioidentical, there's not enough physicians trained in it yet. After the Women's Health Initiative came out way back in 2002, women were being taken off, hormone replacement therapy. It led to the whole generation of women having all kind of symptoms but not being treated. And now we know that bioidentical hormone replacement therapy works really well for a lot of patients. But there are just not enough physicians. I have a patient that will say even they don't even have one doctor, not the gynecologist. Nobody is doing it. So telemedicine has made it available for certain therapies where now they can employ physicians from across the country. It's not localized to one small town. And the women from the smallest of town are able to access bioidentical hormone replacement therapy. So that and then also, there's a lot more collaboration happening, and I think the cost also. Forget about it's accessible, and then the cost is actually much when even for bioidentical, if it is in a brick and mortar, there is a lot of cost. The medicine is actually more expensive for the patient. When they come into telemedicine, a lot of it is cut off the time. They're not traveling anywhere. They're getting the medication at the comfort of their home. And the doctor appointments and algorithms are being used at the back end where my time with the patient is reduced because algorithms have done part of the work. And so then when I'm spending the time, I'm spending lesser time, which means the doctor cost is also less. So it is not that the physicians are spending an hour with the patient. It is we're spending lesser time, but AI is doing a lot of work at the back end. So I think there is this idea that physicians will become redundant in some way is, that's what they said way back when technology first came, right? It's like, it's not going to happen like that. But what is true though is there are times when local physician may not, or there might be some medical error or something, and patients they can use technology to their advantage. And I think it also doctors can use technology to their advantage. So I'm seeing it done responsibly. It will definitely be a great help all over from the patient perspective and the physician perspective.
Yeah, on the same line of telemedicine, I just want to ask you one skeptical question on the quality of care. So, how do you see the difference in the quality of care when a patient walks in versus when a patient just takes the online consultation?
I find the quality of the care actually equivalent, and there is no drop in quality. And why I say that is a lot of physicians, a lot of the diagnosis, anything that requires uh, in-person exam, we do refer the patient and we say, you need to be seen in person, because I'm not interested in putting my license at risk. So I'm not going to want to treat you for something that you can later on come after me and say, doctor, should I refer you? So, like for this patient with the cellulitis, I told her, I'm going to put you on antibiotic. I see that you've got $200 copay, but you got to go. This is not optional. So, it was an option for me to say, refer the patient. So, I gave the antibiotic, but I picked the option saying, I suggest your patient. I documented it. And I made it very clear to her, just taking this antibiotic may not, it's just I'm just giving it right now, but she better go to the doctor. And if the doctor doesn't have appointment, she needs to go to the ER. So because at the level of the business of medicine affects at the higher level. Physician is a healer. We are wanting to heal the patient. We didn't become doctors so we can just make money. We became doctors because there is a part of me that wants to see, if you come with cough, I want to see you better. If you come with an anxiety, I want to see you better. If I didn't want to see you better, I could have picked another profession. I didn't want to be, I could, why become a doctor and deal with a human being who's so complex? I can, so so doctors in general, I have not found them to be lacking in compassion or anything. So they will always do the right thing. So but a lot of diagnosis can happen with symptoms. Say, for example, patient says, I've got sinus pressure and I'm feeling pain and I've got it for 2 days and I've got this green discharge coming from my nose and I'm having a headache. It is sinusitis, whether I touch it or not touch it, you know. So I can start the right antibiotic. I know the allergies. That patient making an appointment to a doctor will take longer. Whereas in the urgent care platform, I'm seeing them when they're waking up literally in the middle of the night and putting it in, the platform that I'm working for. It's called First Stop Health. And I'm able to just pick it up and see them. It's 2 a.m. for them, but they woke up with this lack of breathing. Of course, they have to wake for the morning for the pharmacy to open up. But other than that, they don't have to go to the doctor, see if the appointment, urgent care cost is cut. ER, they have to wait for hours at end for the same antibiotic. But if there was like something, there was another patient. Yes, today I saw 88% oxygen saturation. Anything under, even 94%, I would send it. So he said 88%, and I'm glad you called, but my wife wants me to drive me to the ER. I said, go. You need to go because you've got history of obstructive sleep apnea and you are 88%. You need a breathing treatment like right now. They might actually admit you because you're 88%. So that patient needs to go because, there's no way I'm going to treat him on the phone. It's not safe for him. His oxygen is too low. So I haven't seen that drop. In fact, physicians are in general more very, there is a bit of, unfortunately in the world today, there is a bit of a defensive medicine, right? We always want to err on the side of extra care, not less care. So when there is telemedicine also, we always want to err on the side of and interestingly, telemedicine space, there is not so much litigation, anything malpractice, it's not an issue because of the way doctors are handling it and the way companies are also realizing that there are limitations, and they create a lot of guardrails around what can be practiced and what can be not practiced safely.
Yeah. I think one point that was highlighted for me was now when this patient called you at 2 a.m. and then you just directed them to the ER. I think telemedicine not only reduce the cost, but also it is A, giving them a peace of mind because they're getting the right consultation even at the midnight. And then B, you sending them to the ER, now giving them the right direction, what to do instead of just panicking. So I think it is a great way to see the telemedicine as no as an enhanced care for the end user, which is a patient here.
Yeah. Yeah, definitely. It is today. Telemedicine is in primary care, in urgent care, in hormone replacement therapy, all different fields. I think pretty much all specialties are using telemedicine. Even physicians, we have companies which are primarily consultant based, and then a primary care physician can use telemedicine to talk to or send a message to. In value-based care, we use a lot of that, right? We don't refer out as much, but we use telemedicine platforms to send questions regarding a patient that are a little complex. Like say somebody has rheumatoid arthritis and it's an older person, they're not going to go to the doctor. Well, we can ourselves talk to a rheumatologist. They can send an answer. So there are telemedicine platforms like that too, which is just specialists where the specialists are available to work with the doctors. So with the primary care. So this is not to the end user, but for supporting the primary care doctor who might be in person. So the
Right.
primary care is in person.
And then there is a synergy, right? I think that synergy matters a lot.
Yeah, exactly.
And I just want to jump to another point that you have noted, which is the burnout isn't about now treating the patients, but more it is about, as you pointed out, the quality of the food that doctors are getting. And then maybe the front desk failures and then the technology failures. So it is more of a system failure than anything else. So, why does the system disempower its most highly compensated people?
Yeah, it is so unfortunate. And, I was looking up for 2026, to go to a conference for physician well-being, because now that I'm independent and now that telemedicine has given me the flexibility of time and location, I can be attending a conference and still be working, right? So I thought, well, this weekend, actually, I spent time looking up conferences that I would love to attend in 2026. So one of the areas that I want to attend is Physician Burnout Conference. And guess what? There is there is hardly anything available. AMA has, there's one conference in England that's coming up. And then other than that, there was nothing. Yeah. So I looked up a conference. Yeah. So International Conference on Physician Health is in September. But other than that, there was nothing. I was so sad to see that. They might have been smaller. I've attended once a conference in New York about physician burnout. And there also the conversation was that the clinical leaders who were involved for their company or their hospital system to be in the committee for physician burnout were feeling disempowered because they're in the committee, they want to make a change, but there's not enough funds for that. There is, so they were talking more about the frustration of it rather than solutions because they're not empowered to make solutions. So why is this? Because the business of medicine is the short-sightedness of it takes over. The physicians, the turnover of physicians is so high in these, whether you look at a hospital system, any company, they're constantly talking about this. There is that initial when sign-on bonus, right? Physicians will get a sign-on bonus for 2 years or 3 years. It's a retention bonus because it's like, you will get like so much amount every year for the next 2 years or next 3 years or next 4 years in a way to keep you tied to this company because they know the moment, say somebody has a retention bonus for 2 years, sign-on bonus for 2 years, at the end of 2 years, they're going to quit. If they're not quitting, they will, if they give a resignation letter, then there will be another attempt to keep them by giving them another attention bonus. So it is, but money is not going to keep doctors, it, and physicians are, like you said, they're not burned out by seeing patients. It is not the patient that is driving us crazy. It is the system, and the system is driven by not about the patient, not about not taking care of this human being that is actually going to take care of the patient, but rather like how much can they be productive today, or how much can you generate today, and in return, the pressure just keeps building. They're not and I've seen the enough issues in both the models, where it's like the number of responsibilities between, and even, and technology plays a role. For example, when I went to New York for the conference, one of the things that came out for fee for service was because of technology, patients are able to message the doctor directly. But patient is happy, but the doctor finishes work at, say, stop seeing patient at 5 o'clock. Now there is going to be this avalanche of, messages that they have to attend to. They attend to the message, they go to sleep. By the time they wake up, there's again messages. So technology, so then they're leaving because doctors are like, oh my God, there is no in between. Somebody else should be handling those messages. There should be a triage. Doctor should not be this fallback guy, right? For every failure of mediocrity of every at every level. It's like, you don't know how to handle this fax, or that has come from some third party. Well, let me just send it to the doctor. Doctor will figure it out. So it is happening. Patient is not driving the doctor crazy. It is like all the other players in between, or refills, medication refills. There'll be like 10 repeat message for the same refill, because guess what? The pharmacy sent 10 reminders, and guess what? All 10 reminders go to the doctor. So, and the doctor's already filled the medication, but nobody's checking the chart. And the doctors, so it is truly the system failure, and somebody needs to get into it from the technology angle and say, okay, what am I going to do to reduce physician burnout? I've seen less in telemedicine space is the only place where I've seen right now. And all the brick and mortar place, whether it's fee for service or value based care, they better figure out a way, or they're going to lose doctors to telemedicine or to other platforms which are very physician friendly. So earlier, physicians didn't have a way out. But now I have tons of physician friends who are all in telemedicine. And the reason is about the same. And this is, I'm talking young doctors right out of residency, and older doctors, and all in between, and all specialties that are finding this way out only because they haven't found any place otherwise listening to them.
So you recommend the young residents to explore the option of the telemedicine, just to make sure the systems are way better than the physical offices?
Yeah. I think totally, right? So I would say all these, the companies that are, whether it's hospital systems, whether it's independent companies, they need to actually seriously explore, because literally right now, anybody wants to talk to me and talk about burnout as a physician, I'm going to say, explore telemedicine. There is more and more companies, there is more and more need, it can reach larger population. Your knowledge can be widely used. You don't have to limit it to one little Palm Beach or one little area and just drive it to one office and be burnt out. And, there's somebody whipping you constantly, telling you you're not doing enough. That's what the doctors are hearing all the time. You're just not doing enough. Do more. And so instead you can be sitting at home and figure out, and it is not just is it physician friendly. You can be home, you can be traveling, you can be eating your food on time, and you can control your time, and you can also, and you could be actually a W-2 for that matter in telemedicine space too, and you're still better off, 10 times better off. So, and you're not driving in traffic, or you could do a hybrid model, but really they need to set up all these brick and mortar places. They're so far behind when it comes to, they're running things just like they used to. And without embracing technology to that extent, it's very little, I think healthcare always lags behind. AI is in everything, but not healthcare is now catching up, right? 2025 was the year, or more like 2024, mid 2024, when it was like, oh, maybe healthcare needs to. So it is the new area, but more and more need to. And I think it's a great field for tech companies to explore how can they improve, tech guys to figure out how to reduce physician burnout by incorporating what can they incorporate into brick and mortar. And to that effect, I want to talk about this one company that I just became an advisor for, and they are doing just that. They're working with the fee for service and value based care models in specific area, which is called the star scores or HEDIS scores. And I've been advising them for the last 1 year, but the whole point they even started, and it started by tech guys. And the whole idea was, how do we reduce physician burnout? And instead of physician trying to remember when to do a mammogram, when to do this, can we take it all? And can we work with the staff? And the physician doesn't have to take on that burden, because a lot of it is an area which is so difficult to get the patient to comply, but the physician bonus is attached to it. So physician works hard, but then doesn't even get the bonus because they didn't meet the metric. So that's why this company is working in that area. So again, I'm glad they thought of it. And my role is as an advisor, because I have experience on the other side, so I can advise them of what are the pain points. So hopefully more companies like this will come up.
Yeah, so you have seen like the better and the worse of both worlds. Now you have been the physician, and then you have been on the management side, and then now you are on the telemedicine side. Like, for a young resident, who has no such real life experience, by opting to telemedicine, is there any downside to it?
I would say probably you're right. Probably yes, a little bit. Maybe they should do hybrid. Maybe they should, and that's what's another thing brick and mortar things need to offer. This whole idea that physicians cannot do hybrid models has to be rethought. I think there's opportunity where you can, there is 4-day work week, right? That has come
Right.
for a lot of doctors, right? But it is still the 5th day ends up being completely a work day for them. They're just doing messages and more messages. It's not really a free day for them. But if there was a hybrid model, it probably would be better. I've seen physicians right out of residency getting into telemedicine, but I think a lot of them are we need that young blood and to get into telemedicine more from the perspective of developing. So what's happening, what I'm seeing the new breed has, they are, much more, they grew up with technology. They know about, so they are, like I have a young physician, he's working with this company in developing this platform. So it's like they understand technology better. They are able to work with these AI companies better. They are able to develop apps better. So they're working in the field. They learn the difficulties. Residency is very difficult too. So it's not like residency is just theory, right? Residency, you're actually patients. So, but they're able to, so a lot of them that I'm seeing that are getting right into telemedicine are those kinds who are entrepreneurs. They've got something going. They may be doing a podcast, and now, and right in the second year, they started doing some medical podcast, and now they're developing some app. So this marriage between tech guys or tech gals and the resident and this new physician who knows so much about technology, can think and has a brain that can computes and is also medical. Like I can't do that, right? So I didn't grow up with the internet, but these guys grew up with all the apps. So that's an area where I'm seeing the young people are much more into development, whereas personally, I am, I have ideas and but I really need someone to walk me through that. So there is opportunity, and I don't want them to all docs. Personally, that's I wouldn't want all docs to come out of residency and like factory workers. Now let's go to the some outpatient or no, because if everyone went like that, then they'll come churn out a few years later, all burnt out. Um, and sadly, among all the professions, medicine physicians are the number one for suicide, right? And then women physicians more than even male physicians. So there's this, I forget now what is the name of, there's a nonprofit that is primarily doing, exhibitions around the country, um, where I've been to that exhibition in Columbus, of all the physicians who were high ranking physicians, of very accomplished physicians who ended up taking their lives. And and the stories behind it is you know that it was like a train going, towards its downfall. So it was going to crash, right? So I think we need the young blood to get into it early. Um, and not think like, oh, I need to have more and more ground experience and then burn out and then come out of it.
I want to move on to another topic of your credentials beyond MD. You got an official degree in Ayurveda, and then the yoga, and then you got masters in spiritual psychology. How are you weaving these non-traditional tools into your current telemedicine work? I have never seen someone on both sides. I have seen now a lot of people on the both sides fighting with each other. I have not seen someone who is in the middle, got both of them working together.
Yeah. Yeah, that is an interesting journey because I was your hardcore allopathic doctor. I really didn't believe in anything. I did holistic. I really didn't. All my 20s, I thought, you know, turmeric was just a colored spice. I didn't know it had any anti-inflammatory properties, and I didn't know that um, any food was a medicine. Was not a concept that was taught to me. I didn't even. I ate healthy only to stay slim, but for no other reason. Like, gotta eat macronutrient, gotta have so much protein, gotta have so did that, but didn't understand the deeper science or anything about it. I didn't even believe it. I thought the answers always were with allopathic medicine. And then when I reached mid 30s is when more and more I was questioning idiopathic disease. Everything was idiopathic. Now you have an arthritis, idiopathic. You have a rash, idiopathic. You have, eczema, idiopathic. I was like, so many diseases are just idiopathic. I mean, there is no way to know what is the root cause for it. And that made me start thinking about exploration. I didn't know any better. Somebody suggested to me the first thing I did was holistic nutrition. Yes, that's the first one I did. Somebody suggested to me, I wanted to do my fellowship, Women's Health Fellowship. I did my research in barriers to weight loss in women. And when it was for African American, Caucasian, and Hispanic women, we did focus groups. What came out in those focus groups was that there were depression and moods associated with it, with overeating, eating in the middle of the night. So that was my first exposure because I had never been overweight till that point. So I didn't understand, as a doctor, I just thought people just didn't have willpower and didn't ate unhealthy. And the idea of giving somebody diet advice was just lose weight, eat more protein, just very, because there was no lecture that we got on nutrition in my medical school or residency. So, so then I come out and I start exploring. So in that, when I did that research, it got me thinking, and I became more and more. By my mid 30s, I was already feeling burnout. I was feeling like there has to be a better way, and I wanted to start a holistic weight loss practice for women based on at that time my knowledge. I had not yet done anything else, but all I knew was that there has to be. I know these women are depressed and anxious about their weight. I want to help women. I'm always been a girl's girl. So I was like, okay, I'm going to help. I did Women's Health Fellowship. So I'm going to start a holistic weight loss practice where it's all going to be diet and nutrition based at that time based on what I knew. And because I started planning that and I opened up my own practice, there was a nutritionist. She walked into my office and said, I can be, off. This was, I lived in Cincinnati. So she came and talked to me and said, I can be an holistic nutritionist for you. And I did my course from this Institute of Integrative Nutrition in New York. It's like, what is that? So that got me, that was my first. So then I said, I want to sign up. I want to learn what that is. So I did holistic nutrition there. Then they talked about masters in spiritual psychology. My one of the coaches there had done it. I thought that was, what is that? I'm a doctor. I don't need spiritual psychology. But then it got me thinking about how, because spiritual psychology, she gave me a book, Loyalty to Your Soul. And when I read that, it actually didn't sit well with me. The first time Loyalty to Your Soul talked about how authentic living would be, how you can be loyal to your soul. And I felt like I can't be loyal to my soul. I am, I have to be loyal to the Indian culture. I have to be loyal to Indian family. I have to be loyal. Like my voice can't. I mean, if my authentic voice comes out, then that's going to be a problem. No, I have to be a good wife. I have to be a good daughter-in-law. I have to be a good daughter. I have to be a good mother. So there was a lot of shoulds that I had been living with. I grew up in India in a way where as a girl, my voice was very suppressed. So I thought this book never made sense, to me. And then I went through a very, very transformative experience. I went to India for a trip with my kids, and I wanted them to see India in a way that I wanted to show them India. So it was all, the highest resorts, the most expensive resorts. So I wanted them to like India. So I take them to anything real, nothing on the street. Gotta be high end, just so everything. So this trip is going really well. There was a 2-week trip. My daughter was 10. My son was, no, not even 10. My daughter was 8. My son was 5. And so we go on this trip, all good. A day before my family, I was staying for one extra. The day before they were going to fly out, we went in Mumbai to buy to a street side vendors where my aunt said, this is a great place. So we go there. And the shopkeeper ended up groping my daughter. And that led to me. I mean, it was that before that, Anisha and Dr. Singh, and after that. So I put that guy in jail that day. I was like, even the police was like, who puts somebody in jail for groping? I'm like, this cannot happen to my daughter. But that, and of course, my daughter flew. I came back to US. I was very traumatized. I went through my own therapy in Cincinnati with a nonprofit. Instead of suppressing, how voices are suppressed, India, groping is such a big issue. But when I was a child and I went through groping, it was like, it wasn't talked about. I told my parents and they would be like, we don't talk about these things, right? So now I was I was like, this is like, so I spoke about it. My daughter healed from it. I ended up then reading that Loyalty to Your Soul again. And that is when I started connecting to the dots that I can't keep suppressing. I need to live authentically. And so it was an inner transformation that led to me doing spiritual psychology, finally accepting and healing my childhood traumas. And it started a totally alternative journey of my life. That led to then I had been doing yoga, doing yoga teacher training. Life became about how do I do the small pieces to make life more authentic. And then that led to Ayurveda. So it's almost like yoga teacher talked about Ayurveda. So then I thought, when I was like, this sounds like holistic nutrition is where they talked about Ayurveda a little bit. So, well, they gave us an insight into all different, from macrobiotic to all kind of different diets. And Ayurveda, I found to have depth. So that led me to, okay, I need to get into Ayurveda. So I did the course from Chicago. It was a 2-year course, and 1.5 year into that, I ended up with breast cancer. So that's another journey that I took. But that that is where it's like the shift has been as a soul. Uh, it's been like different people came into my life and took me through that journey. And as a human being, as I was evolving as a human being, this journey, it's like, and I have incorporated all of it into even an urgent care visit patient gets benefit of my knowledge. If you come with cold, you're not just going to get antibiotic, but you're going to get ginger tea with honey and whatever, depending on what's going on. I might give you salt water gargles with turmeric in it instead of just saying, take this antibiotic and be done and take a lozenges. No, I'm going to incorporate, and they love it. Patients get benefit from it. It really, so I'm able to very customize it. In a very short time, I can sense it, and yeah, so it has truly made me a better healer, a better doctor.
Well, I just want to touch on the cancer diagnosis part, since you mentioned about it. Uh, I want to talk on like in a different angle. Uh, then you mentioned to me that you were able to return to work and then maintain high energy throughout the chemo. I just want to know, what was the secret to your resilience? Is it the book that you read, or is it the spiritual psychology side, or is it the Ayurvedic side, or what's your thought process? What was going on that helped you to maintain those high energy levels?
Yeah, so it came out of nowhere. My breast cancer, I did not have any family history. I did not smoke, drink. I was 20, 30 pounds lighter than what I'm today. I breastfed all the risk factor, breastfed my children a year for a year, had my kids before the age of 30, all the way that allopathy talks about, right? Western medicine, the way we say, what are the risk factors for breast cancer? I didn't have any. So, and I was high energy when, even on the day I was diagnosed, like I did not have any symptoms of that's how breast cancer is. It's very insidious. And so one thing I do tell women is do get your mammograms on time, because I didn't. I was like, yeah, I don't have a family history. I don't need it. So I'm at 47. It's like suddenly, I find my own lump and end up finding this breast cancer. So of course I spend my one day crying. A lot of crying happened when I got diagnosed. That lasted for maybe 2 days. And then the thought was like, there were two things. One, I was doing Ayurveda, but that didn't kick in first. What first kicked in was the spiritual, my growth that had happened so far. Now, spiritual word is overused, so I don't really like to use it as much. But it was more about how can I go through this experience. Uh, n- if can I all that I've ever read, can I put that into practice? So if I have read, I am not the body and I'm not the mind, then can I put that into practice? So if my body has breast cancer, then can I go through do all the treatments I need to do for the body? And yes, body will have some good days and bad days. And then if I'm not the mind, so then even if, first of all, why should anything that, we make the connections, and we say body mind. So we say whatever affects the body affects the mind, whatever affects the mind affects the body. So this is an understanding that has come even in mainstream, right? We talk about body mind. So we know now there are diseases. Stress will give you a heart attack, right? We know that. So body, but if because you think you are the body and the mind, when something happens to the body, you get disturbed. And when you're disturbed, then something happens to the body. But what if you were neither one of them? So could it be that I am a consciousness who can observe my mind and who can observe my body? And so I became really an observer. And I was the center medical director at that time for one of the centers in Cincinnati. I had just been promoted on my birthday, November 10th. And then April 21st, I'm diagnosed. It's not even, 6 months into my new role. And my center was one of the top centers from all the metric standpoint. So I was like, there's no way we are going to go down. So I told my center, like, look, we're going to treat this as hypertension. This is, if I ever I told you I had hypertension and you have hypertension, we don't make a big deal. We're not going to make a big deal. Nobody's going to come to me and say, "Oh, doctor's saying you have cancer." None of that is going to happen. We're going to go through treatment. If it was in the middle of COVID, so if it comes to the point where I need to take time off, I'll take time off. I'm not, going to think, but I'm not going to unnecessarily take time off if I'm feeling well. And then basically I called my Ayurvedic teacher who I was going through second year. So she's a Vaidya, she's a doctor, and wonderful. If anybody ever wants, that's the one I refer. Dr. Rawat is my doctor. So I contacted her and told her, like, I can't continue the classes. I'm just got diagnosed with breast cancer. So she's been practicing for 30 years. So she said, you have to go through, because first my thing was, I don't want to go through chemo and radiation. I've heard so many side effects. I will become incapacitated. I won't be able to practice medicine or whatever. She said, no, go through all of it, but I'll work with complementary. And I will not start you, because oncologists do not like, patients to be started on any herb or anything. So they're not going to put you on any supplements or anything. It'll all be food-based. So I put all of that, whatever she told me, including giving up on my chai, on my tea, no tea. I followed it. And it is so interesting that I saw the benefit where, first of all, I had my first oncologist. When I went to meet her and I told her, it's an interesting story, right? So she's like very confident oncologist, has been treating breast cancer. She writes on this paper all the things she's going to do. And she wants me to be off the whole 9 months. Or I think 6 months. I forget now. And I said to her, after she's done talking, I said, you know what? I'm working with my Ayurvedic doctor. She had never heard of the word Ayurvedic. So she's like, I said, it's a holistic and I'm going to manage it with diet. And I don't want to take time off. Oh, she was not happy about that. She was like, this is COVID time. You're going to get infection. And so what did I do? I changed my oncologist. That is what a patient needs to do. You got to know, you got to stand up for it. Because guess what? If doctors think they know, whether it's allopathy, Ayurveda, any doctor, if they think they know it all, they don't know it all. That's where AI and ChatGPT comes into play. Because guess what? You may know narrowly about your field, but you don't know everything. So when doctors start claiming I know it all and they're condescending to a patient needs to stand up for their rights. So here I was, the patient, a doctor for God knows 20 plus years of practice, and being treated in such a condescending way. The way that oncologist talked to me, I never went back. And I got another oncologist and I explained the same thing to her. I said, I will take a break if need be, but I don't want to just declare that I'm sick. So I'm feeling well. And this one was very accommodating. She had also never heard of Ayurveda, but she said, I will work with you. If you're feeling good, you're fine. So guess what? My breast surgeon told me that after I had a lumpectomy and then I had 4 positive lymph nodes, they took out 15 lymph nodes. And she said, I will be 6 weeks off work. I was how many weeks off work? 1 week. They said I will be on pain medications, Percocets. I took how many days Percocet? 1 day. So, there is a power in food and medicine. And I'm not even talking about supplements. I'm not talking some ashwagandha. I'm just talking food. And then chemo started and people said, that is definitely going to bring you down. Chemo, after the second chemo, you won't be able to work. I worked through all the chemos. I was bald. I had lost eyebrows. I lost my eyelashes, but I didn't lose my energy. That was the thing. I could see patients, and I was not even drinking tea. So it's like, I think sometimes patient would feel like shy about telling me their problem, but I was like, no, tell me, because I didn't have a loss of energy. And that is all thanks to the diet changes I did. Now, I would have joint pains, for example, but they were not like, if I got chemo on Friday, Saturday, Sunday would be delicate for me, but I didn't have any nausea. I didn't have vomiting. I didn't have any any tingling, numbness, neuropathy, all of that controlled with food is medicine. So I think it cannot be called even alternative medicine. It's got to be complementary. We all got to you know, learn that we all have limitations. You can have such strong chemo drugs that you need to have complementary, be able to, and it's for the benefit of the patient. And there is no other field except healthcare where the customer doesn't come first. Well, for the customer, you should make it, right? But everybody's got an ego, like I know best. Well, guess what? The customer, I was the customer, and as a customer, I'm telling you, um, without chemo, I wouldn't have been cured. But without Ayurveda and food, I wouldn't have been productive. And by the way, our center did awesome. We stayed on top. We never dropped in our metrics. And then when radiation happened, that was a daily radiation for 30 days. And I was told that radiation, finally, I was being told, okay, finally, this is going to get to you. So you 2 weeks into radiation, your legs will feel like elephant legs, and you will need to, take off for the final 2 weeks. So I was ready for that. But I said, okay, maybe if I don't feel that, at least I'll have a sleeping bag in one of the patient rooms. If I need be, I'll just take a rest in the afternoon. The whole 30 days went by, and I think 2 weeks even after that is when I realized, oh my God, I never used the sleeping bag. I never needed to. And I didn't even have, like normally people get radiation and they get blisters and, skin itchy. I had none of it. So, and then people want to say I'm lucky. It's not luck. It was a very strategic decision to partner with all the resources on my fingertips. You got to think, it wasn't about my ego. I was an Ayurveda allopathic doctor, but and then on top of that, both my kids got COVID during that time. And I still didn't get it because I think my diet was better. A year after everything, I did get once COVID, but during it, even when I did get it, was so mild. I worked through it from home as telemedicine for my practice. But I think my immunity has become stronger. And I really think it's like the life took me through and then eventually gave me the experience. And not only that, made me such a humble doctor now. I don't judge, if my patients are not eating well, I don't judge it. If they get cancer, I don't think oh, you had a bad, your lifestyle gave you cancer. No. So overall, I'm a better doctor because of my cancer experience. So I'm grateful for that experience.
That's a wonderful story. And when all I feel is you carefully designed that whole program for yourself based on your own feelings. But how can anyone else replicate whatever you did?
And that is something, I want to, I have referred a few patients to Dr. Rao since then who've been cancer patients, and they have had some, benefits to it. Like I have one in my practice, husband with throat cancer, that he got a lot of benefit from that. There have been a lot of people have told me, you need to write a book about it. You need to talk about it. I do want to. Now that I've got the flexibility, I want to be able to create breast cancer awareness, but also mindset. And what I mean by that is, there is breast cancer is very cure for most part, right? We all got to die of something someday. So it's not like immortality. Today somebody's going to die of cancer, somebody from car accident, somebody from stroke. So it's going to happen from somebody from old age. But even with old age, something's going to happen. They're going to fall and they're going to break a bone and they're going to lung clot and then they're going to die. So either way, they're all not going to die. But I feel like this whole experience has, with with cancer especially, cancers used to be not so curable cancers, right? So there was a lot of, oh, you had cancer, this kind of a thought, right? If you have blood pressure, I don't go oh my God, you have blood pressure. Because even though you're the one, if you have blood pressure, you're the one on medication for the rest of your life. I'm the one who got treated and done with it. So actually, you should be there are patients taking pills for diabetes, hypertension, and cholesterol, the metabolic syndrome for the rest of their lives. And so, with the cancer, you wear like a victim crown. It's like, poor me. And, the everybody also makes you feel like poor you. And I do see certain diseases still untreatable, like Parkinson's, really untreatable, multiple sclerosis, still we don't have answers to it. Those I really feel like they struggle a lot, towards the end. I mean, years of struggle before they actually go. Cancer today is curable and manageable, even if it's not curable. So most part, like it is a lot of it is curable. And then of course there may be recurrent, but then again I say, like, there's got to be a reason to go. But we don't have to wear a victim crown. We don't have to make it into a sad story. We can make it into an evolution, a journey of evolution, because we all are going to get hardship. Somebody's going to get one kind of hardship, somebody's going to get another. I have yet to meet, in my master's, when I did my master's in spiritual psychology, we were 200 adult students. All of them had a story, a sad story. They had come to spiritual psychology because of some childhood, and now they're coming into it for looking for answers. So I find that, whether it's physical illness, whether it's somebody may have been a bad marriage and that's their story. Somebody had a bad abuse from childhood. That's their story. Somebody has cancer. So we all have to find ways to come out of it. So I think personally, that's one of the things, and that I want to work in: physician burnout and breast cancer awareness. That is one area that I want to talk about. And of course, grouping. That is another area, all my experiences that I want to spread awareness about how it's going to look. I mean, I've just got into this space. So, but that's the intention down the road of how to find a way.
Well, that's a great story, and then, like, on the same line of cancer, and then the way you designed your own program, I just want to jump onto your childhood dream of having a medical tourism in an Indian village. So I know it's your childhood dream, but it might be making much more sense now because you're more into holistic. So can you just talk a little bit about it?
So my childhood dream was actually to work in in a village in India. I never had a childhood dream of going to America. Even in my growing up years, I never thought I would go to America. I didn't have that dream. My dream was I used to imagine myself, there used to be actually a vision of myself in a sari with a doctor's bag and going in villages and treating the underserved. In a way, in my value-based care, the population I served were the underserved. So that I have seen the poorest of the poor in America, right? I did visiting physicians, so that was house call physicians. So that was also, I saw how I've been to trailer homes, and same thing, value-based care. I've seen the underserved. But now with the way I am designing my life, I want to be able to develop. My goal is to develop sort of I've been to actually Nicaragua also through ChenMed. They do this awesome job about going to Nicaragua for medical mission trips. I've been there 3 times and talked to the physician there who set it all up, and a great organization. And we go to the underserved people. We do camps there. And we need something like that in India. I've traveled to the furthermost spots in east of India and Bengal, and I've traveled in Gujarat a lot. And I've seen a lot of villages where there is lack of healthcare. So I don't know why it was a childhood dream, but what was a childhood dream now? I want to be able to develop this, which turns out, but I want to be able to bring my physician friends in there. Just do that kind of a medical mission where I'm able to meet the not just so the underserved, the villagers, be able to provide them free clinic or minimal cost clinic, but be able to create a model. And this is where one of the things I've been also thinking about is how to utilize telemedicine. Also, I had a meeting with another, since last I talked to you, I had a meeting with another person about like, could it be that the reason doctors are not there in villages because it's not lucrative for them. Well, what is like, I am doing urgent care and, primary care through across 50 states. Imagine some model like that in India, where the doctors could be sitting in another part of, they could be sitting in Indore and they're sitting in Hyderabad, or they're sitting in Bangalore, and they are able to give 2 hours a week into that space with the villager is able to join for minimal, but it is effective. It's the doctor also not even volunteer. Maybe they're working on the platform, so we're creating a model where both will be helped, but then also be a model where we can bring physicians. I can bring physicians the way I traveled to Nicaragua from US and be able to do camps, take it into where creating a system where they can serve, but also get to see India in a small, 3, 4, 5 days, 1 week, 2 week, and create more holistic approach that way. Like it's not like bringing only medicines, but the physicians that will come would also be into lifestyle and into food, into just overall well-being. So having compassion, but also the experience. So the village tourism, now it turns out, or medical tourism is a big thing. When I was thinking this, I didn't know these words even, but uh, you know, but what I think, it makes perfect sense to create more where the villages are also helped, the person coming is also helped. Like I met today here a couple from France. They're here, and this is second trip to India, and they just love coming to India. They knew so much more about Kerala and other parts of India than I've never been to actually. So they were talking about things, um, and 40 years ago they also came to India. So I was thinking, like, there is a such a interest in this way of life, understanding this way of life, and for it makes a physician more well-rounded physician. So when you take them across the world in different, and physicians have a giving heart as such, but then bringing there are already some companies or some nonprofits that are doing a little bit of. I'm finding out, that there is some bit of, doctors are coming from US a little bit. But I'm looking to expand that. I'm actually going to Kolkata, tomorrow, and I want to meet with the Ramakrishna Mission there. There is a Ramakrishna Mission month there because Ramakrishna Mission also turns out they do medical clinics. So I have to figure out that's a dream project. Like that's my pet project that I would love to develop in a village in India and expand it. Even work with the government of India if possible on this project. I can bring the best of both worlds into it, help the villages, but help the community, raise awareness, and bring in, help also India for that matter. So,
Well, definitely. So, it sounds like, you have said for 2026. Uh, so, and then you said, like in the Tagore area, you wanted to establish this. And definitely you need, the partners and the collaboration. So, what are you looking in partners or collaborations to help bring this vision to life?
yeah. So yeah, the area that I'm interested is in, Rabindranath Tagore, Shantiniketan, that's Bolpur, that's a Bengal. And so what I'm initially looking into is actually starting with the land, right? So trying to figure out, we haven't bought even the land. A lot of the investment initially, right now, I'm actually thinking of investing my own funds into it till I get to the point where I can now I'm finding that there are ways that I can work with the government too, if it's a nonprofit. But right now it's such an early stage. I'm going to invest 5 funds and then see if there is opportunity, and then take a loan actually, and then start from the very bottom, and then there are so many friends of mine that have said, just start something. We would love to partner with you. So maybe there'll be other physician friends that would join me in this project. But yeah, that's where right now it's and there is not. I cannot tell you that there is a. I think for me, the 2026. So I'm a strategist. So I'm not going to. That life has to. You got a plan. So the whole 2025, you get the move into. Now it's finally into telemedicine. Now how do I get from this phase into the next phase? So it's a couple year project to get it all set up. But I'm in no rush to cut any corners, and it'll happen it's just that every week I'm moving the needle a little by little. But I'm very thoughtful about creating weekly timelines. So that's how I'm doing it right now. So like I was talking to you about, right? The conferences, to partnering, but like it's literally a week by week deadlines that I have got.
Well, the momentum in a positive direction is always better than running in circles. So,
Exactly.
yeah, I just want to ask you about going back to the burnout thing that you were talking about. That was a real pain. So, like, what is your one piece of advice for any physician who feels trapped by I would say, the golden handcuffs of corporate medicine?
Yeah. Yeah. What is my one advice? Be very mindful when you're looking for a job. Don't go with who's paying you the highest. Ask the right questions, and ask them like, what does the day look like? Talk to some of today the world is well connected. You will find physicians that might have left the practice on LinkedIn, maybe. Talk to them. So not just talk to the current employees, but talk to the past employees. Why did they leave? There might be other reasons to leave. So for me, I will tell you one of the examples, classic example is me. I didn't just leave because I was disappointed. I also left. That is just a evolving picture for me. Like, oh, the answer, it's not, grass is not greener on either side. There's going to be, I am a hard worker. I'm not afraid of hard work. It's more about the corporate, the pressures coming that come unnecessarily, not just on me, but like, I don't agree with this concept of putting pressure on doctors. So, or the provider, frontline, whether nurse practitioner, whether it's, I don't care, the frontline. So, but also the stage of life I was in, my kids had grown up. I was now an empty nester. I was in the phase of life where I could think of creating my own blueprint, of how my life should look. So I knew that I was moving into a different phase of life. I had, we talk about in the culture that I grew up in, we talk about the grahastashram, we talk about the brahmacharya grahastashram and the vanaprasthashram and sannyasashram. So for me, it was clearly a move into a third phase of where I am ready to, my world is not limited to my children and my family. It is time to now think beyond. I'm not becoming what I call myself is a yogi who's a karma yogi, or even actually a bhakti yogi. So which means that I'm ready to think beyond self. It's not about what I can accumulate, but it's about what I can give to the larger, and the whole world is my family rather than just two kids that I give birth to, or my mother or my father, then or my sisters. Not that way. So that is in general the phase of life I was moving into. I wanted to have flexibility of time and space. I wanted to do nonprofit. I wanted to do, I had intention of purpose in life beyond just so I wanted to do good for patients, but I also and I didn't want my income to drop, but I also wanted to make sure I was talking about larger issues. So, talk to other ex-employees. Some of them may be leaving for other reasons, but at in any job, whether you're working for outpatient hospital, whether you're a specialist, whether you are working in a nursing home, whichever format, whichever jobs you're looking for, make sure you're asking the right questions and not just giving in to these, whoever is the highest salary. That's the new doctor makes that mistake, right? They're like, okay, this one's giving me this one, this one's giving 20,000 extra. Let me go with this one. So but what is that 20? And then secondly, don't sign too long of a sign-on bonus. Don't get drawn by that. You don't get, if they're going to give you 100,000 over a 4-year period, guess what? Don't sign that. Do 1-year sign-on bonus. Don't do more than 1 year, actually. Don't even do 2 years. Because good practices would not be afraid of, there could be a cause where you can say, okay, I will revisit this after 1 year. But even that, don't be drawn with that thing, because then now you're stuck with 2 years with a company that you now realize you don't even like. But you would have to, there's a clawback. So you have to give back the money if you leave early. So all of that creates conflict. Rather going thinking, just like what tech guys do, they don't stay in job. Nobody's giving them sign-on bonus. If they get a better job, don't the tech guys jump sooner? That's how it should be, so that nobody thinks they got you. And right now in healthcare, they got you. Doctors, that's how it is. You sign them on for a longer period and now they got you. And now they can ill-treat you. They can put pressure on you. They know you're burning out, but then they're still going to make you feel incompetent because you just didn't, and women physicians, it happens so much more because women sometimes in fee-for-service model, they especially because women will have longer visit because they are more compassionate. They may be more of a vessel. And so I've seen physicians where women physicians feel so much burnout because there's so much pressure. Like, you need to make your visit shorter. You need to make your visit shorter, right? So, there is just just don't lead with money. Go with your first job to learn. What are you going to learn in this job? And how are you? Yeah, just learn, because coming out of residency and fellowship, you don't know much. How you're going to learn about the business of medicine, how you're going to learn about how the system works, how you're going to learn in a more complicated case. So satisfaction won't come from your paycheck. It'll come from those things. And then if it doesn't feel right, go find another job. There's enough jobs waiting for you.
Well, this is such a wonderful conversation, Dr. Singh. Thank you. Thank you for your time today. Definitely, our listeners would enjoy the range of topics that that you just discussed, and the depth of those topics. But one topic that I want to revisit with you in the future is the body and the mind, and then the way you started observing them as a third person rather than attaching to them. So definitely, I want to talk about that whole topic as another podcast. And in the meanwhile, I wish you good luck for your the Indian Village medical tourism project.
Thank you. Thank you for giving me this opportunity to speak from the heart. I find your podcast very genuine, and thank you for the interest. And yeah, let's continue to collaborate. And I look forward to future conversations.
Thank you, Dr. Singh. Have a good evening.
Yeah, you too. Thank you.